Hi, this is Dr. Jenny Byrne. I'm an adult psychiatrist at Cognitive Psychiatry of Chapel Hill, and today I wanted to talk with you a little bit about benzodiazepine withdrawal. And this is something that I find most people don't know very much about. Most people know that if you drink a lot of alcohol on a regular basis, that you can have alcohol withdrawal if you cold turkey and stop drinking alcohol. So what I want to tell you about today is that you can have a similar problem with benzodiazepines. So what are benzodiazepines? These are medicines like Ativan, Valium, Xanax, Klonopin. There's many different types of benzodiazepines, and they all work on a receptor in the brain that's similar to how alcohol works. They work on the same receptor but in a different way. So many people are prescribed these medicines for anxiety, sometimes for sleep, and they're very commonly given by primary care doctors. So why is it important for you to know about this? Well, if you get in the habit of taking these medicines on a regular basis, and by that I mean more than a few times a week, your body will get used to these medicines and you can develop something called dependence. So if you get used to these medicines and all of a sudden you stop using them, your body has a reaction because it's not getting what it's used to. And this is called withdrawal. And the important thing to know about benzodiazepine withdrawal is it can be very dangerous. So say you had a primary care doctor prescribe you some Valium because you were feeling anxious, and you got in the habit of taking it maybe almost every day or once a day or twice a day. And then say you decided to just stop taking it, or maybe you went to the hospital for a procedure and you stopped taking it. The things to look out for in terms of withdrawal would be things like feeling your heart is racing, your blood pressure is going up and down, feeling shaky, anxious, jittery. And if this continues, it can even lead to things like seizures, and it can even lead to death. So withdrawal from benzodiazepines can be very serious, and it's very important to know about. Another important thing to know is that the window for withdrawal is fairly wide. So if you stop cold turkey on your benzodiazepines, just because you feel okay for the first day doesn't necessarily mean you're out of the woods. You really need to get through at least a week or two before you're completely out of the woods for withdrawal. So if you take these medications, I definitely recommend you talk about it with your primary care doctor. And if you're taking them regularly and you want to come off of them, please consult with your doctor first about a safe way to do this. So I hope this has been helpful. If you'd like more information, please feel free to contact us at the information below. Thanks. Bye-bye.